Good afternoon. This is a nurse aid tutorial. I believe that will help you in passing your nurse aid exam. This is also a project for me, but I am going to teach you as much as I can to get not only the point across, but also to help you achieve certification. Let's get started, shall we? A nursing assistant is an auxiliary position. It is overseen by a licensed nurse. A licensed nurse is defined as an RN or an LVN. It can't be graduate. To perform basic care to patients such as bathing, grooming, blood pressure monitoring checks, blood sugar monitoring checks, etc. Nurse aid may not perform invasive procedures such as IV therapy. They may not perform any advanced techniques in or outside the hospital. This position is an entry-level position. It is very basic care. Some may give medications, and this is usually referred to as medication aids, medication assistance, reminders. But that's another certification outside this one. Um, Depending upon your state, nurse aides may only be renewed for may only carry a license for 2 years. You must renew after 2 years. If you do not renew after 2 years or it has lapsed over, you will need to actually contact your state authority for their rules and regulations on exactly getting your license back. The philosophy of nursing assistant is to provide care to patients that lack independence regarding ADLs. You will see that again. ADLs is activities of daily living to ensure patient safety and the well-being of the patients, to ensure that the order of the head nurse, duty nurse, charge nurse is all the same title, or physician are carried out accordingly. In order for you to achieve certification, you must be taught first, correct? That means you must go through training. Your trainer must have a Bachelor of Science in Nursing in order to teach you nursing. And they must be licensed in their particular state. They must be either RN again or LVN. They cannot be a graduate nurse. A graduate nurse is someone that has graduated from an accredited nursing school but has not taken their boards yet or has not gotten the results yet. They must have the card with you. Uh, they must have the card on them in order to delegate orders to you. Okay? Nursing is defined as looking, touching, smelling. These senses will help you not only become more connected with your patient, but it's also used as an observation tool when reporting findings to your charge nurse. I want to go over consents with you, which I believe that are very essential in your career. Implied consent means that I have seen a patient and they're unconscious, but I believe they will want me to go ahead and apply heroic measures to them that covers you. Express consent means that I have verbally told you, yes, I would love medical treatment. Non-compliant means I do not want to take my medication. I do not comply with the medication regimen or the nursing care plan. I want to also go over the Good Samaritan law with you. Please be careful when performing the Good Samaritan attitude. For the minute that you touch that patient, when you become certified, the minute that you touch that patient is now your patient, and you are actually responsible for that patient from the time that you actually start applying care to the time 911 actually comes there to relieve you. And 911, the paramedic must say you are released of duty in order for you to leave that patient alone. Okay? Clients or patients or persons that have not received care yet. They have not received services yet. Patients are people that has started to receive services yet. Example, patients, you are actually grooming them that morning. You're actually getting their vital signs. Those are patients. Clients, you have did nothing for them yet. They are just walking through the door. You have not applied any medical techniques to them. Okay. When interviewing clients, this is a state board test question. When interviewing clients, you must have more open-ended questions than closed-ended questions. Open-ended questions are questions that do not end with yes or no. It's as simple as that. Closed-ended questions are always yes or no. Did you go to the store? Yes, I did. That is an actual closed-ended question. You need to have more open-ended questions. So if the state board asks you, do you, which is an example of a open-ended or closed-ended question, you would say closed-ended question, yes or no. Okay. Also, another state board question that will be on your test will be the stages of pressure sores. Pressure sores are actually when the patient is actually on their back or on their particular side for long periods of time, greater than 2 hours, causing sores, causing heat. So, number one will be redness in the area. You usually see a red spot there. Number two, that red spot, the actual skin has broken. It is chipped. It's broke. Number three, it is now broke through the first part of the skin, and now the fascia is exposed. That is the lining of your muscle. It is exposed now. Stage four will be all the way through the skin, the fascia, the muscle, all the way down to the very bone. That's why it's so important to make sure that you turn your patients every 2 hours, that you are actually looking at them every 2 hours when they are actually non-ambulatory. Stage 1 and Stage 2 heals. Stage 3 and Stage 4 never heals. So you can just imagine how bad that patient is feeling. Remember, any changes of condition must be reported to the licensed nurse immediately. Any falls, any breaks, any cuts, burns, any type of injury must be reported to the licensed nurse on duty. If you have any patients, remember your ABCs and your CPR training. A for airway, B for breathing, and C for circulation. So if you see a patient that is in distress, if you're in a controlled environment, you yell code blue, or you actually get somebody that's near. If you're in an assisted living, you have someone to stay with them and someone calls 911. There are actually two different types of strokes, CVAs, which is cerebral vascular accident. There's hemorrhagic, there's an actual bleed in the brain, and then there's actually an occlusion, which is a blood clot. At this time, that is too far off your scope, but it does ask about strokes. Your state board does ask about falls. So please be advised that every answer is tell the charge nurse. Hepatitis, you will need to know more about that also, for not only for your state test, but for also your for your own safety. Hepatitis A. Hepatitis is actually an inflammation of the liver, and it can cause a grave amount of damage. Hepatitis A you usually get from food and fecal. B is from blood and sexual. C is also from blood contact. D, you must have B in order to get D. And E is very rare in the U.S. It is usually transmitted by bad water. Also, according to your skills on your clinicals, hand washing is very, very essential. It is the number one disease killer, I should say. It prevents disease. If the